What if you could tackle a massive public health crisis with an app that millions of people already have on their phones? Well, today we're looking at an absolutely brilliant idea that came out of the Smart India hackathon that proposes to do just that. Let's dive right in. So, just think about it for a second. You've got a question about a symptom, or maybe you need to know about a vaccine schedule. Where do you go? For a lot of us, right, a quick online search or a call to a doctor is pretty straightforward. But what if it wasn't an option? And that is the heart of the problem we're talking about. For millions of people, getting reliable, verified, and just understandable health information is a huge, huge challenge. It leads to all sorts of misinformation and, can cause dangerous delays in getting care. But this is exactly where a simple, really elegant idea comes into play.
Okay, so what is this amazing solution? It's a proposal called AmaJibana, put forward by a team that calls themselves Quantum Crew.
So, what is AmaJibana, really? At its core, it's a smart AI-powered chatbot. But the real magic, the genius of it, is its accessibility. It's designed to work in a bunch of different languages and over the most common platforms out there. We're talking WhatsApp and even basic SMS. You can think of it like having an automated, trusted health advisor right in your pocket. And when you look at the features, you really see how big their vision is. This isn't just some simple Q&A bot. No way. It's built to handle multiple languages, give you tips on preventive care, keep track of vaccination schedules, and this part is absolutely crucial. It connects directly to official government health databases. It can even send you real-time alerts if there's a disease outbreak in your area. That all sounds fantastic in theory, right? But how would it actually work for an everyday person? Let's break down what that would look like. And this is where the simplicity is just brilliant. Imagine you just send a question in your native language, say about your child's fever. The AI uses something called natural language processing, or NLP. It's just a fancy way of saying it's trained to understand how real people talk, with typos and slang and all that. It figures out what you're asking, instantly checks the official sources, and then sends a clear, simple answer right back to your phone. No apps to download, no confusing websites to navigate, just a simple text. So here's the big question. Is this just a nice idea, or is it actually doable? Let's take a look at the foundation this whole concept is built on. Wow. I mean, this number really says it all, doesn't it? Over 400 million WhatsApp users in India. The delivery network is already there, it's already built. They're not trying to create a new platform from scratch. They're piggybacking on one of the most widely used communication tools on the planet. The potential for scale is just immense. And this is the part I think is so clever. The creators totally get that not everyone has a smartphone or steady internet. So by also offering the service through basic SMS, just a regular text message, they make sure the chatbot can reach rural and remote populations. It bridges that digital divide and makes sure literally no one gets left behind. When it comes to health, trust is everything, especially if you're trying to fight misinformation. And this is where AmaJibana would get its answers. It would be integrated directly with official sources like the Ministry of Health, the COEN vaccination platform, and even the World Health Organization. This ensures that every single piece of information it gives out is verified, accurate, and totally up to date. And this idea isn't just, floating out there in a vacuum. There's real academic research that backs this whole approach up. Studies have shown that chatbots are super effective in rural health settings, that they're perfect for scaling up information during an outbreak, and that they can even help lower public anxiety during a crisis just by providing fast, reliable answers. The proof is there. So you've got the tech, you've got the users. What's the ultimate goal here? What kind of real, tangible difference could a system like this actually make in people's lives? Well, the potential impact is just enormous. Think about it. It can raise general health awareness, maybe improve preventive care habits. Those early warnings for outbreaks could literally save lives. And by answering all the common questions, it could take a huge strain off of overcrowded clinics and hospitals. I mean, this goes way beyond convenience. For so many families, not having to take a day off work to travel to a clinic for a minor health question is a massive economic benefit. This quote from the project team, Quantum Crew, really just sums up the whole mission perfectly. It's not about flashy tech just for the sake of it. It's about using technology in a very focused, very smart way to achieve a clear and vital goal: better health for everyone. And that really leaves us with the powerful thought to chew on. This whole proposal is focused on public health, sure, but the principle behind it is universal. If a simple conversational AI can bridge such a critical information gap, just imagine its potential in other areas. Think about education or agriculture or government services. What's the next great challenge we can solve, one simple conversation at a time?